Ma'am, you were talking about menstrual cramps and pain. So, would you like to tell us something about what causes painful or irregular periods and what is your approach in treating the same?
Maximum girls they experience pain during menstruation, and this is a very natural, normal phenomenon. I would say that once the endometrial lining, deposits, it grows, and this only sheds during periods. Now, what happens once there is recoiling of the vessels and the endometrium tries to shed? There, prostaglandin is released, and because of this prostaglandin, there is constriction of the musculature wall of the uterus as well as the blood vessels. Once the blood vessels constricts, there is less flow to the endometrium. Now this endometrium then dies off because of less blood circulation, and they shed off. Now because of the contraction in the uterus, there can be pain. Now this particular collection of the menstrual blood, when it comes out through the canal, sometimes the canal might be too small. It might, so there might be pain during passage. Sometimes there may be even abnormality in the uterus, that is congenital anomaly in the uterus. Like we have got septate uterus, we have got uniconvate uterus, we have got biconvate uterus. Uniconvate uterus also is very painful menstruation. So there we try to find out if the girl has any other causes of development anomaly for the pain. Again, there are two main diseases in the girls which we usually get some like. Once a girl comes to us, we give her the initial treatment. Supposing she fails to respond, then we definitely go in for a sonography to find out what is the congenital anomaly, one is whether she is having endometriosis. Endometriosis is a very painful condition during menstruation. What happens here is the menstrual blood, there are some ectopic sites which have got endometrium along with the uterus, blood collection in the uterus. The blood collects in the ectopic sites. The blood in the uterus comes out during periods, but the other sides they cannot release the blood. It collects there, and thereby it causes excessive pain. PCOD is one of the cause of pain during menstruation. Irregular periods. Irregular periods in puberty. Once I now come to puberty, I'll start from puberty. Nowadays, girls they attain puberty at a very young age. Very young age. Why we say young age? Because nowadays girls they try to know earlier. Their maturity comes earlier. So the sexual year starts, not sexual anymore, the sex hormones they start working early. So a girl can menstruate early. Physically they are very active. Cycling, dancing, running. No girls they stay cool nowadays. So that this can be a factor of early menarche. So in young age, a girl might menstruate for the first time and then again she might stop. She might not menstruate irregular. There nothing to fear of. We try to explain the mother that this because the girl starts menstruating but the hormone status hasn't started working in her body then. So there can be irregular ovulation. So once there is irregular ovulation, only after the ovulation the periods occur. Right? So in puberty usually up till the age of say 15 we don't bother much. We try to explain the mother. We try to tell the mother you will be cool. Let time come, this will get spontaneously okay, and it takes 2 years time to become okay. In spite of that, say after 2 years or so, we ask the mother to return, to come back to ask and say, if it's okay, fine, if it's not okay, then we try to investigate and see what can be the causes. Again, irregular periods can be because of some hormonal problem, it can be because of thyroid problem, it can be because of this one, again I said congenital anomaly in the uterus, it can be because of some hormone pills intake, it can be because of some even if a girl comes to us, we try to exclude one thing, taking definitely we ask the patient don't take it otherwise, but as a doctor I have to ask him, even in teenagers, unmarried girls, we have to exclude pregnancy because nowadays like unmarried sex it's done. So we have to exclude at least if the girl is of that age group. We usually try and exclude even pregnancy. And if it is so, we try to help them because nowadays even after their girl crosses 18 years, even she's scared to tell her parents that she's pregnant. Only with her signature, we can take her and go and get the abortion done.